Hi, Jake. I'm Kenny. I'll be your physician assistant for the day. So, what brings you in here?
I've just been having this cough that's been going. I feel like it started just started about a month ago, but now it's just like getting really irritating.
1 month. Okay, as you said, it started a month ago. And do you remember what you were doing beforehand when it started?
I honestly feel like I just woke up with it one morning, and then it started bothering me. And then I felt like it was just a typical cough that would go away, and then it just kind of progressed, and now um, it's sort of like uh, I'm having trouble when I'm like walking upstairs,
Okay.
or I have like some chest pain with walking upstairs.
Okay, and have you found anything that makes the cough any better?
Just like sitting still and just being relaxed throughout the day.
Okay, and you said it gets worse after you walk upstairs, right? Right, and you said that the cough's gotten worse over the past month?
Yeah,
And have you ever had this happen beforehand?
yeah. Honestly, I would say it happens. Now that I'm thinking about it, I feel like it happens like once every year. I get this type of thing going on.
Once a year. Okay. And does the cough, like, does it hurt anywhere else? Like, do you have any other symptoms
No.
besides the shortness of breath?
Yeah, and it's really, it's only, I don't feel like I have chest pain. It's like when I'm breathing, I have chest pain. Like when I'm breathing over my exerted normal amount.
That's
Does that
when you
make
feel
sense?
yeah, that's when you feel the chest pain. All
Yeah.
right. You said the shortness of breath when you go upstairs, feel better when you're sitting alone.
Yes.
How would you rate the pain in your chest on a scale of 1 to 10?
As I'm just sitting here right now, probably uh, 2.
A 2. And how about when you walk up the steps?
It's kind of just like a 6 to where I just need to take a second to, gather myself.
Okay. Have you noticed any sputum that comes up with a cough?
Yeah.
What color is the sputum?
Just like mucusy, but it's clear.
Clear mucus? Okay.
Yeah.
And how often does it come up? Every time you cough, or
Mainly just like in the morning. Like I'll get up all the mucus.
in the morning when you wake
then
up?
It's just like an annoying cough throughout the rest of the day.
And how much of the sputum would you say comes up each day?
Not like
Well,
a crazy amount, just like a napkin full.
Just like a napkin full? Okay. All right. And have you noticed any wheezing that you're doing over time?
Well, I wouldn't say that it's more than what's normally there.
Okay, so no excessive wheezing
Yeah.
afterwards. And do you suffer from asthma or any other diseases like that?
Asthma, no. What do you mean with any other like
Have you ever had pneumonia?
Um, no, but I've had a few bouts of bronchitis,
Had bronchitis?
and
Did you smoke?
well, yeah.
Tell me a
I've
little
probably
about
been
smoking.
smoking around a pack a day for the better part of 20 years.
Okay, smoking 1 pack a day for 20 years. And have you tried stop smoking after this cough's come on, or it's hard to?
It makes me smoke less because I feel like crap, but I still smoke.
Okay. And when's the last time you got a chest X-ray?
Um, I normally do one every year. I'd probably say with my doc. I probably went to the doctor about 5 months ago.
Doctor about 5 months ago got a chest X-ray. All right, cool. And have you noticed any weight changes with the cough, or
No, just
no?
normal.
Weight changes normal. Have you had any fever?
No,
Any fatigue? Besides when you're short of breath?
just the shortness of breath.
Okay.
Yeah,
And no weakness?
No.
Okay. Have you had any heart problems with the cough, or just the chest feels tight?
Just my chest feels tight. Yeah, I take my blood pressure pill, and other than that, like
Oh, what med are you on for your blood pressure?
Lisinopril.
Lisinopril.
Take 10 milligrams every day.
10 milligrams. And do you suffer from high blood pressure?
Yes. And like I don't think I have any other like heart associated problems.
Okay. Do you take any other meds?
Just my Sympacort.
Sympacort.
I
Okay.
don't really remember the dose on it.
What are you taking that for?
It's just it's for my lungs.
For your lungs? Okay. You've had some lung problems over the
I
years?
think they did that for my bronchitis.
Okay.
Yeah.
That's it. Did they diagnose you with chronic bronchitis?
Yeah.
Okay.
Yeah.
That's good. So this is the cough that comes up yearly, right?
Yeah.
That's good. And does anyone in your family suffer from this kind of cough, or?
Well, no one in my family is.
No one in the family with this. Okay. Do you suffer from any allergies that would maybe make the cough worse? All right, now we'll get into a little bit of the past medical history. So I'm going to read a long list for you,
Okay.
and you just let me know if you ever had any of these diseases. The measles?
No.
Rubella?
No.
The mumps?
No.
Whooping cough?
No.
Chickenpox?
No.
Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Diphtheria?
No.
Psychiatric disorders?
No.
And then a little bit about the immunizations back then. Do you know if you received your polio vaccine?
Yeah, I think for anything that I needed to get, I got.
So you got your MMR,
pretty on
Hep
top of
B,
all my stuff.
tetanus, diphtheria, DPT,
Yeah.
rotavirus, chickenpox, and pneumococcal.
Yeah.
All right, cool. Now we'll ask a little bit about the adult illnesses. So have you ever had thyroid disease?
No.
No. Heart disease? You said you suffer from hypertension, right?
That's it.
Hyperlipidemia?
Yeah, cholesterol's been good.
Diabetes?
No.
COPD?
They haven't told me that yet, but they have told me about bronchitis.
Okay. Cancer?
No.
HIV?
No.
Hepatitis?
No.
Kidney disease?
No.
Blood clots?
No.
And you said no psych problems, right?
Yeah.
All right. And immunizations, you get your flu vaccine every year?
Yes, every year.
Okay. Hep B, your herpes zoster, and your pneumococcal?
I'm pretty sure I'm up to date on all those.
Okay. So when were you diagnosed with the chronic bronchitis? Do you remember?
So I've had this going on for like the chronic cough, I guess, per se.
Yeah.
I think they told me in year 3, because it's probably about 5 years straight.
Gotcha.
That I was developing that. So, but all my like lung testing was good.
Had no problem getting
Yeah. Yeah. So now I just feel like this year it's a little bit worse than
Getting
years
worse over the
before.
years.
Yeah. So
Okay.
I guess that's why I'm here.
All right. And the only other diagnosis you had is the hypertension, right?
Yes.
Okay. And when were you diagnosed with that?
Probably 10 years.
About 10 years ago. Have you had any other accidents or injuries in the past?
Like that.
Any hospitalizations that you recall?
No.
No. Okay. Any surgeries that you had to have?
Not that I can think of. No.
No surgeries recalled. And then you stay up to date on your health maintenance. Have you had a colonoscopy?
I haven't, but I'm pretty sure I'm due for one soon.
Okay. Soon. Do you get your prostate and testicular exam?
Yes.
Yes.
At the every wellness check.
Get screened for TB?
I haven't in a while. My work used to make me do it every year, but now.
What you do for your job?
Well, I was in construction, but now I kind of moved to an office. So.
What you do for construction?
Exterior housing.
Exterior housing.
Yeah.
That's nice. How'd that go for you?
Oh, good. I'm glad to be in the office. I don't have to do all the labor.
How long did you work out in the field for?
9 years.
9 years out there? Okay.
I did most of like the painting.
Oh, a lot of painting?
Yeah.
And have you had your cholesterol checked?
Yeah, actually, that one's good.
Good
Just
for
my blood pressure.
cholesterol.
Yeah.
And have you had any lung cancer screening since you have the problem with the lungs?
I have had one, but it was a while ago. It was not my last checkup. May have been 2 years ago, and yeah.
Okay. All right. And we'll get into a little bit of your sexual history. So, are you sexually active at the moment?
Yes, I'm married.
You're married. Okay. How long have you been married for?
We got married at 18.
Got married at
20 years.
18. Ah,
Yeah.
congratulations.
Yeah. 20 years.
And how would your partner describe their gender? Excuse me.
Oh, woman.
A woman. And do you guys use protection when you have sex, or
No.
no protection? Are you guys trying to have kids, or
No.
no? But you guys.
Kids.
And any new partners in the last 6 months?
No.
No. Okay. Any history of STIs?
No.
No. And in your relationship, do you feel safe with your wife?
Yes.
Okay. And you feel respected by her?
Yes.
Okay. And so you don't have any concerns or questions for me? All right. So now we'll get into a little bit of your family history. So I'm just going to read a long list of disorders, and all we're checking for is if your grandparents, your parents, any of your siblings, any of your children or grandchildren, if they suffered from any of these things.
Okay.
So headaches?
No.
No. Seizure disorder?
No.
Stroke?
My dad died of a stroke at 80.
Dad died of stroke at 80. Okay.
Yeah.
Any mental any mental illness in the family?
No.
Any suicide?
No.
Any substance abuse?
No.
Any thyroid disease?
No.
Any coronary artery disease?
I'm pretty sure my dad had it.
Dad had that as well. Okay. Any hypertension besides yourself?
My dad.
Your dad with that as well. Any hyperlipidemia?
Dad.
Any diabetes?
Mother.
Is your mom still alive now?
Yes, she is 75.
Mom said 75, and she's doing well besides
Yeah,
diabetes?
she just has diabetes.
Any asthma?
No.
Any tuberculosis?
No.
Any renal disease?
No.
Any arthritis?
No. Any
allergies?
No.
Any cancer?
Dad had lung cancer.
Lung cancer? Oh, okay.
Healthy guy.
Any genetically transmitted diseases that you know of?
No, not that I know.
Okay. And are your grandparents alive, or did they pass?
Grandparents have passed.
Passed, and do you know how they all passed?
I never met them.
Oh, you never met them?
No.
Okay. You said your dad passed of a stroke.
Yeah.
Your mom's still alive, has diabetes. How about your siblings?
I am actually an only child.
Only child? Nice. How'd you like that growing up?
Just run around the neighborhood.
Yeah. Sounds good. And so where were you born at?
I was born in Henderson, North Carolina. It's like a pretty rural community.
Henderson, NC. And did you have a good childhood? How would you describe it?
Yeah, my parents gave me everything I wanted.
That's good. And what's the last year of school that you completed?
High school.
High school? And then you went into working?
Yeah.
Nice. And you said you worked in construction and now are in the office,
Yep.
right? And what do you do in the office?
I just manage project management.
Gotcha. And in your house, it's you and your wife, and how many kids do you have?
We just have two.
2 kids. And do they have any problems?
No.
No, they're both good. All right. And is it 2 boys, a boy and a girl?
Girl
girls?
and boy.
Girl and a boy?
Yeah.
Nice. All right. And you guys all live together at the moment?
Well, they're in college, but
Oh, they're in college?
they come home for the summers.
What schools do they go to?
Chapel Hill and Wake.
Nice. Do you have any sources of stress in your life right now?
No, honestly, I'm outside of the kids being at college. I'm all right.
That's good, man. And you don't have any background in the military, right?
Yeah.
And are you okay financially? You don't have any problems?
As good as we can be
Yep. And what do you do for like your leisure activities? Like, what's your ideal way to have fun?
Big Bears fan. Like to do outside stuff with my dog and try new restaurants.
Oh, nice. And then you don't have any problem doing stuff around the house, right? You bathe
No.
yourself,
Yeah.
dress yourself.
Walking up the stairs and then it's
Walking up the stairs is the only problem. Uh, do you use the telephone fine? Does your wife do the shopping, or do you
Yeah, she pretty much handles everything bill related
feel really okay?
and like daily.
You have no problem taking your meds and all that. You're
No.
good with that. You can uh, manage the money yourself.
Yeah.
And do you have any religious or spiritual beliefs?
Yeah.
No.
Not religious.
And any exercise that you do, stay in shape, or
I haven't been doing as much because normally I kind of rely on my work because I put work in the field, but
hmm
I am starting to be back on track.
Good. And what would you do when you're trying to get back on track?
Me and my wife just take like a daily mile walk before work.
Nice. And what's your usual food intake on like a on
I
a
will say that we're
normal day?
normally pretty good. Sometimes I like the salty foods too much.
Okay.
But she cooks pretty healthy meals.
She cooks pretty healthy.
Yeah.
And do you drink any coffee or any drinks that have caffeine?
Coffee every day.
Coffee every day. And how many cups would you say you have?
Once in the morning and once at 2 o'clock.
Coffee. Okay. And do you drink anything else besides that? Besides like a water? Or do you drink soda,
Water and
iced
beer.
water, and beer? How much beer would you say you have a week? Is that like your typical
Probably 12
go-to?
pack a week.
12 pack a week? You would say you're under control with that, right?
Yeah.
Do you drink every day of the week or most of the
Nah,
weekends?
if we're not drinking, I probably drink like
3
3
beers a night?
Yeah, 3 or 4 beers a night. And throughout the week.
Right? And you get good night's sleep or
I feel like I'm sleeping
try
pretty good. Granted, the cough when I lay down sometimes.
have a problem laying
Yeah.
down?
But other than that, it's not anything crazy. That's only sometimes.
And you practice all the safety things, wear your seatbelt in the car, wear a bike helmet, do you wear sunscreen when you're out in the sun?
Yes.
Yes. Do you have smoke detectors in the house?
Yes.
Keep your cabinets when your kids were little. This probably doesn't contain as much now, but you lock the cabinets for meds and
Yes.
stuff like that. If you have any firearms, you lock them away.
Yes.
And you and your wife, you guys both seem happy in the relationship.
Yeah.
Okay. Do you do any other alternative healthcare practices?
No.
No. Okay. And you said for tobacco use, you've been smoking for 20 years, 1 pack a day?
Yeah.
You started when you were 18?
Yeah.
And do you use any illicit drugs or
Nah,
just tobacco?
Just cigarettes and beer.
Okay. And now we'll get, there's going to be a lot of questions here. Bear with me. So we went through the general. You said your weight's been fine. Your clothing fits the same, right?
Yeah.
No weakness, fatigue, or fever. Just fatigue with the shortness of breath.
Yep.
Have you noticed anything on your skin, like any rashes?
No.
No. Any lumps?
No.
Any sores?
No.
Any itching?
No.
Any dryness?
No.
Any change in the color of your skin?
No.
Any change in your hair or nails?
Now that you think about it, sometimes my nails get sometimes a little bit blue.
You get a little blue in there? All right. Could be signs of your lungs. Any change in the size or color of moles?
No.
Any headaches?
No.
Any head injury?
No.
Any dizziness?
No.
Any lightheadedness?
No.
Has your vision been okay?
Yes.
Do you wear glasses or contacts?
No.
Do you know when your last eye exam was?
When I went to the doctor about 5 months ago.
5 months ago. No pain in the eyes.
No.
Any redness?
No.
Excessive tearing?
No.
Any double or blurred vision?
No.
Any spots or specks that you see when you look out?
No.
Any flashing lights that bother you?
No.
Any glaucoma or cataracts?
No.
And your hearing, is that okay right now?
Yes.
You don't have any tinnitus or vertigo?
No.
Any earaches? No ear infections? No discharge coming out of them? And do you use hearing aids?
No.
No.
It's
Okay.
been good.
Hearing's been good. Do you suffer from frequent colds in the nose or
I don't really have any nose involvement.
no nose involvement? No stuffiness up there?
No.
Any discharge?
No.
Any itching?
No.
Hay fever?
No.
Any nosebleeds?
No.
Any sinus trouble?
Thankfully, no.
All right. How's the condition of your teeth and gums? Say it's normal.
I feel like outside of smoking, ruining them.
We're doing
I brush my
okay
teeth every
besides
day.
that.
Sometimes I
Just
don't
the
floss.
smoking. Do you notice any blood in the gums?
No. When I used to dip.
Yeah, you used to dip too.
Yeah, it was like my first 5 years of smoking.
Okay.
I used to do both, but now.
You quit dip about 15 years ago.
Yeah, 15 years.
And do you wear dentures?
No.
No. When was your last dental exam? Do you remember?
I haven't been to the dentist in a while.
Okay. And do you suffer from like a sore tongue or dry mouth?
Really? I haven't had any problems.
And do you have any sore throats?
Sometimes with the cough, when
The
it's just like
cough
coughing
irritates?
all day. But other than that, it's nothing crazy. Like nothing that kills me or anything.
Any hoarseness in your voice that you noticed?
That could be with a sore throat too.
Any swollen glands
Nah, not that
in the neck region? Any goiter?
Nah.
Any lumps that you found? Any pain in the neck? Any stiffness of the neck?
Nope.
Any lumps in the breast area? I don't know if you checked there or not.
No, I haven't noticed that.
Any pain?
No.
Any discomfort?
No.
Any discharge from the nipples?
No.
And do you practice self-exams or?
Not typically. No.
Not typically, okay. And for respiratory, you said you have the cough, right?
Yes.
You said you have the sputum, but that's only really in the morning.
Yeah.
Suffering from shortness of breath.
Yeah.
Wheezing, but not anything that's not uncommon. And you suffer from pain with deep breath, right?
Yeah.
Last chest X-ray was 5 months ago.
Yeah.
No asthma, but you do suffer from bronchitis.
Yeah.
No emphysema.
Feel like they might have told me that one time.
You think they might have said
Yeah,
emphysema? You're not 100% sure.
Yeah.
No pneumonia and no TB. Okay. You said no heart problems, right? Well, there's the hypertension,
Yeah,
height trouble. So that's high blood pressure. No rheumatic fever.
No.
Any heart murmurs that you've noticed,
No.
or chest pain and discomfort just with the deep breathing, right?
Yeah.
Yeah. Okay. Any palpitations that you've picked up on?
No, nothing I picked up on.
Shortness of breath. You said yes. Do you feel that you need to use a pillow at night to ease your breathing?
I kind of like prop myself
You
up.
prop yourself up so you don't like to lay all the way back. Okay. Like that. You need to sit up at night. Have you noticed any swelling in your hands, ankles, or feet?
No.
No. And have you had any testing done on your heart recently, like an EKG?
I think they did one a year ago.
EKG about a year ago.
I haven't had anything else besides that.
Okay. And do you have any problems when you try and swallow? No. Any heartburn that you've noticed?
No.
Any appetite problems?
No.
Any nausea?
No.
Are your bowel movements the same as they've always been?
Yes.
And then the stool itself usually looks normal.
That's
Okay.
normal.
Any change in your bowel habits? Do you go more often, less?
No, just normal.
And there's no pain when you go. Have you noticed any blood in your stool?
No.
No. Okay. Have you noticed any hemorrhoids or anything like that?
No.
Blood when you wipe? Any constipation?
Been going fine.
It's been going good. So diarrhea is good. No abdominal pain. No food intolerance. Have you noticed you pass gas or belch any more frequently? Normal. Any jaundice? Nope. Any liver or gallbladder troubles?
I don't think so.
And no hepatitis?
No.
All right. Have you had any intermittent leg pain when you walk around?
Yeah, nothing I've noticed.
No cramps down there?
No cramps.
Do you have any varicose veins or clots in the legs that you know about? No. Any swelling in your calves, legs that you've seen?
Mm-hmm.
Any color change in you said you have the color change in the fingertips,
Yeah,
right?
just my fingers. I haven't noticed it like anywhere else. So.
Just cyanosis in the fingers?
Yeah.
Any? All right, we're good there. And have you been going to the bathroom okay? Like pee wise?
Yep.
No, no problems with that. No urgency, no burning when you go,
No.
no blood in the urine, no infections that you know of, no pain in the kidneys, no kidney stones, I would imagine, if there's no pain. No pain above the penis.
No.
All right. Has your screen been the same?
Yeah.
All right. What time are we at? It's at 25. Do one more.
Yeah, it's fine.
Any hernias?
No.
Any discharge from sores on your penis or anything?
Thankfully.
Any testicular pain or masses that you felt?
No.
Okay.
I do that at self-exam.
You do that one? Okay,
Yeah.
good. Any scrotal pain or swelling? Any history of STIs or sexual treatments?
Thankfully.
All right, so that's all. I think we're good.